Welcome to another installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that program that talks about all things Gateway Community Health Center. And today's program is a very serious program, one that you should definitely pay attention to as we start talking about breast and cervical cancer. First, we talk to our Chief Medical Officer, Dr. Mary J. Cortez, who highlights some of the key aspects and research that patients should know about when dealing with breast and cervical cancer. Then we head over to our breast and cervical cancer screening program to talk to patient navigator Liliana Garza, who will guide us through the process patients can take when dealing with breast and cervical cancer screenings and processes, plus financial help they can receive that's exclusive to our Gateway patients. Finally, we're talking about 35 years of service to the community, a celebration with our Heroes in Healthcare Gala that was celebrated in the month of October right here with Gateway Community Health Center. We got it all wrapped up for you, so sit back, relax. Another installment of Gateway Today starts now. Welcome to another installment of Gateway Today. Well, today we are starting with a serious conversation. It is breast and cervical cancer, and I thought it would be important that we sit down and talk to our very own Chief Medical Officer, Dr. Mary J. Cortez. Check it out. All right, ladies and gentlemen, well, welcome to this installment of Gateway Today. And as always, I love to bring on one of my favorite people in all of Gateway to our program. It is our Chief Medical Officer, Dr. Mary J. Cortez. Dr. Cortez, thanks for being here. And we're bringing you on because it's a really important topic that we want to discuss. Obviously, we're talking about breast cancer awareness. And you're dressed for the occasion, right? Pink, highlighting the importance of breast cancer awareness. But I wanted to talk a little bit about some of the things that are happening here at Gateway in terms of prevention and detection, right? And how we go about looking for those things within our patients, right? Talk to me about that process. What is it that we're doing here in terms of screening to help our patients that are concerned about breast cancer?
Yes, we ask in every visit to our patients when was their last mammogram, when they're 40 years or older. If they haven't had one in the past year, we give an order for it. We try to schedule an appointment for them. Also, we recommend to do the self-breast exam for them to see if they notice any nodule, any difference in their breast. And of course, we asked about family history, if there's any mother or sister, sibling in the family that had cancer. So it's like we pay even more attention to it.
You mentioned two things. One was the mammogram. How soon should the patients be getting mammograms that are wondering, have I had a mammogram? Is it under 40? Is it after 40?
It's at 40 and older. Yeah, okay. We start ordering it.
And at what age are you seeing breast cancer? What ages are we seeing right now?
Yeah, unfortunately, right now we're seeing an increase in the incidence of breast cancer. And I want to say it's in all ages, but now we're seeing it in younger women, right? And close to their 40s, sometimes even younger. So that's why the self-breast exam is good, and be paying attention to it. So it comes from the physician, but of course, if the patient requests the mammogram, if they're 40, if there's an indication, we'll order the mammogram. Yeah.
Now, sticking on the topic of breast cancer, I wanted to really touch on what Gateway is really, or how we're expanding with mammography. Can you tell me a little bit about that?
Yes, we're super excited because now we are bringing our own mammogram machine to the clinic. In fact, we are waiting for it as we speak. And so now we're going to be able to schedule our patients sooner. The results are even faster, and we'll have it here in-house.
So really a one-stop shop for our patients, right? Yes. So you come, you see a physician like Dr. Cortez, you order the mammogram, and now they'll be able to come in-house here to Gateway and get it done. How long does the mammogram take, and what does that process look like?
Oh, it's a simple process. It's a simple imaging. There has to be some pressure on the breast, but I would say it's about 10 minutes or less to do the imaging. Yeah.
And then how long before you get those results back, typically from outside provider?
Yeah.
How long would it take?
About 1-2 days while they read it.
And then for us, if we have it in-house, then we would probably see it, what, same day or something?
24 hours probably, yeah.
Okay, excellent. So this is all great news, obviously, for the medical community or for us when we're advancing our services for our patients. Now it can all be done in-house, and so it's exciting stuff. I have a few more questions, but I want to take a break. We have a ton more that we want to cover with Dr. Cortez, so we're going to take a quick break, and we got more Gateway Today on the way. Don't move. We'll be right back.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Well, we are back here with Gateway Today and our guest, our Chief Medical Officer, Dr. Mary J. Cortez. And before the break, we were definitely covering a ton of different topics within the world of breast cancer and breast cancer awareness. And sticking on the subject, Dr. Cortez, I want to ask you about treatments, right? Let's say one of our patients is diagnosed with breast cancer. What do those treatments look like for somebody that may have breast cancer?
Yeah, there's different options, right? It depends on the diagnosis. There's not only one type of breast cancer, it depends on the biopsy. So when we get an abnormal mammogram, the patient will have to get another diagnostic mammogram, and then we will send the patient for a biopsy, depending on the findings. Then once the biopsy comes back, and then the oncologist and the surgeon will decide if there's need for chemotherapy, surgery, excision of the lump or of the breast, and then radiation as well. And there's after that there's breast reconstruction. So those are the options.
When we start to think about cancer, I know there's not a cure, but what does the research tell us? How do we prevent this from happening?
Well, the recommendation is always have a healthy lifestyle, right? Have your 8 hours of sleep, eat healthy, eat your veggies, avoid processed food, exercise at least every day, 30, 50 minutes per day, lift weight. So that kind of stuff. Avoid alcohol, avoid smoking. Right?
Yeah, healthy lifestyle, definitely, and everything in moderation. Now, when somebody is diagnosed with breast cancer, it's definitely, we hear the word cancer, scary. Obviously this is a tremendous news that's given to the patient, and obviously it's life-changing. How is a patient here supported at Gateway in terms of having to deal with this major life-changing, incident?
Yes, definitely it's a strong diagnosis. Something that they have to process is the family processing also the news, right? So here we have our behavioral department, we have the counselors, we have our psychiatrists that can help cope with it. And of course, outside the organization, there are group supports and a lot of resources for our patients. But definitely our counselors are trained to help them cope with the diagnosis and go through it.
An all-in-one, all-inclusive, all-in-one stop shop for patients when having to deal with these, catastrophic illnesses. And I'm glad that you're staying on top of it. You're at the forefront. And, you know, I know you really wanted to really highlight this issue, and I'm glad we're talking about it. If you want more information and learn more how you can benefit as a patient here at Gateway, whether you're dealing with breast cancer or not, feel free to call us at 956-795-8100 or visit us online at gatewaychc.com. And you can find her here at Gateway. She's our Chief Medical Officer, Dr. Mary J. Cortez, right here at Gateway Community Health Center and Gateway Today. Our thanks to Dr. Cortez for always highlighting the importance of breast and cervical cancer for our patients. And again, want to remind you that if you have questions about breast or cervical cancer services right here at Gateway, visit gatewaychc.com. All right, we're continuing with that conversation as we head over to our breast and cervical cancer services program with our patient navigator, Liliana Garza. Check it out. All right, everybody, we are here with Ms. Liliana Garza from our patient navigator for the breast and cervical cancer service program. As we continue to talk about breast cancer within our community, I thought it was important that we bring on Lily to talk about the program and how patients here at Gateway benefit from this service. And so, Lily, thanks for joining us on the program. I know you've been doing this for 6 years, right? Tell me about the program. Tell me about BCCS, as we call it here at Gateway, but tell me about what the program is.
Okay, well, it helps people without insurance or underinsured to check for the woman exam, which is the pap smear and the mammogram. If just in case something comes out wrong, we do help them out more like with the surgeon or with the colpos and all of that. It's extended, and we send them with doctor on site check if something comes out abnormal. And we help them out with the NBCC just in case something comes like with cancer.
Right.
We help them with that as well.
There's so many parts to this.
Yes.
Right. It's extensive. Right. So let's start really quickly with, because I know you just kind of touched on all different aspects. Tell me about the patient process, right? If I'm referred over to BCCS, it starts with the well woman exam. Is that where everything starts? So then once the well woman exam happens, if abnormalities come out, then we refer them out? Yeah,
we refer them out. We have that as well. We help them with that.
Now, for a patient that may have trouble paying for some of these services, there's funding for that too, right? We do. Yeah. So tell me a little bit about that. How, because I know a lot of folks hear the word cancer, and obviously it's a scary thing when we start talking about it, but we have to talk about it. But there's also a lot of costs that come with it, right? So what is assisted financially through the program?
Okay, well, we go back to the PAP. They come in, they do the program. We do through eligibility. So we do need the proof of income or the food stamp letter, all of that. We have a list. They bring that, we do the eligibility, they get approved, they go for the woman exam, we do the appointment as well. From there, they come back with us for the voucher for the mammogram, and then the mammogram gets done. If anything abnormal comes back, we do have a surgeon, which is Dr. on-site check. We send them over with him, and then from there we get it. Like they do a biopsy or whatever they need with him, and we do cover that as well. So all the visits with him, post-op, all of that, we cover it. So it is a really good program.
Yeah, absolutely. It's super extensive in the fact that it helps cover these costs for these patients, right? And it's such a traumatic, just a mind job that it does on somebody that is going through this, right? The fear and the family. It's and this is just a kind of way to alleviate it. Would you say that?
Yes, of course. Yeah, because a lot of people don't know about the program, and then when they come, like, oh, I wasted this, or I went somewhere else, and it was expensive.
All right. So one of the questions I wanted to ask you about was about Medicaid for breast and cervical cancer. Tell me about that program. We're the only ones here in Laredo or South Texas that really deal with this program, right? Tell me about it.
It's a Medicaid. It's like a regular Medicaid, but it's only for people that were diagnosed with cancer from cervical or breast. Like it has to be specific, those two, and we can help them out. Just bring the pathology and we'll do everything else. I'll give you the list that you need to bring, and I'll help you out. that too, a lot of people don't know that we do it here, and they just go to the like regular Medicaid, but no, they have to get the Medicaid because it covers everything cancer-wise.
So questions regarding that if anybody has questions, they would just come to you and you would guide them through the entire process, right? That's awesome. And we're the only ones that have that program here. So that's what makes it really a special thing for our patients here at Gateway. And so we would like to invite you to become that patient. If you're not a patient already, go to gatewaychc.com or call 956-795-8100. You can ask for Lily or any of the other patient navigators. They'll guide you in the right spot and get you to a healthier, more fruitful life right here with Gateway Community Health Center. Hey, our thanks goes out to Liliana Garza, our patient navigator for BCCS, and for sharing that crucial information that patients can take advantage of when dealing with breast and cervical cancer. If you want more information on the program, visit gatewaychc.com. That said, we're talking about 35 years of service to the community. Recently, Gateway Community Health Center got a chance to celebrate those 35 years with our Heroes in Healthcare Gala. It was all brought to you by our platinum sponsor, Falcon Bank, along with all of our sponsors. And right now, here's a sneak peek of what viewers saw at our gala. Check it out.
On behalf of the Falcon family, I would like to extend our heartfelt congratulations to Gateway Community Health Center on their 35th year anniversary. Your unwavering commitment to your mission, which is to provide quality health care for everyone, is truly commendable. You have made a significant impact on the lives of countless individuals in Laredo and the surrounding communities. And your dedication to the health and well-being of your patients is an inspiration to us all. We cherish the beautiful partnership we have formed, and we wish you continued success in the years to come.
For thousands of residents in Webb, Jim Hogg, and Zapata counties, Gateway Community Health Center is a vital link to quality healthcare services that might not otherwise be available to them. What most people don't realize is that these 11 clinics, including one mobile clinic scattered throughout the 3 counties mentioned, and the services they provide are open to everyone. It is a true gateway to good health that provides numerous healthcare services to all who come through their doors. Its mission is quite simple: to provide high-quality healthcare for everyone. This nonprofit organization is a lifeline to thousands of people who have limited resources and cannot afford traditional health insurance. It allows anyone, regardless of ability to pay, access to healthcare services that would otherwise be out of reach. In short, it can extend lives through proper medical care and attention. Low income, median income, or upper income, it doesn't matter here. Anyone can get quality healthcare that fits within any budget. Payment arrangements are geared to the individual and their ability to pay. And more importantly, no one is ever turned away for services from our clinics. Among the services offered at Gateway Community Health Center are child and adult primary care, women's health, dental health, specialty care, support services, urgent care, weight management programs, diabetes care, behavioral health care, and much more. It's important to mention that everyone qualifies for healthcare services, and registering to become a patient is easy. You can register online by phone or in person. For anyone needing assistance in attaining health insurance from the health insurance marketplace, we have certified counselors available to help with applications year-round. There is also assistance available for those applying for Medicaid. When it comes to general healthcare services, adult primary care is high on the list. It includes the diagnosis, treatment, and prevention of acute and chronic diseases and immunizations. We do screenings for diabetes, high blood pressure, cholesterol levels, and other issues. If hospitalization is necessary, Gateway has a hospitalist program where inpatient care is provided at a local hospital by a group of local physicians from admission to discharge. These doctors coordinate care with the patient's primary care provider, or PCP. Pediatric care is another service that falls under this heading. It's provided to newborn infants and children up to the age of 18. Gateway provides both well child and acute care. Immunizations are offered for children and adults at all clinics, and medical checkups are available for patients in all age groups. Specialty care services include behavioral health, which encompasses counseling and psychotherapy for both children and adults. There's even an urgent care clinic open to the public at large, located at the Central Clinic. It's open after hours and available to anyone who needs care for an acute, non-emergency, or non-chronic issue. When it comes to women's health, Gateway offers breast and cervical cancer screenings. Diagnostic exams are provided to eligible women who might otherwise not be able to afford these services. In addition, Pap tests and mammograms are provided at no cost to eligible women over 40 and over 50 years of age, respectively. Gateway offers sexually transmitted disease testing as well. Gateway Community Health Center serves as a family medicine outpatient clinic for the University of Incarnate Word School of Osteopathic Medicine. Residents, under supervision, practice adult medicine, pediatrics, and women's health. It's widely known that healthy teeth and gums are vital to good health. That's why Gateway Community Health Center includes dental services for patients. Our dental clinics offer preventative, restorative, and limited oral surgery services for children and adults. Preventative services include dental exams, x-rays, cleanings, oral hygiene education, and dental sealants. Support services at Gateway include 2 pharmacies that accept Medicaid, Medicare, and private insurance. We also offer in-house laboratories, x-ray, ultrasound, and mammography services, a convenience that allows Gateway patients to get all of their services done in one visit. In addition to diabetes management programs, Gateway Community Health Center offers diabetic supplies, where eligible patients may receive glucometers, strips, lancets, and solutions at discounted and affordable prices. Bottom line, Gateway Community Health Center's 11 clinics, including 1 mobile clinic, offer numerous services that can accommodate just about anyone who needs quality health care at a reasonable cost. At Gateway, everyone qualifies for services. All you have to do is enroll, and we'll take it from there. We're here to improve the quality of life for every person who walks through our doors. Our core values are service, excellence, professional expertise, integrity, dignity, and compassion for all. We are Gateway Community Health Center. In closing, here are a few words from Gateway's Chief Executive Officer, Elmo Lopez Jr.
Here at Gateway Community Health Center, we provide quality health care for everyone, from primary medical care, primary dental care, and primary behavioral health care to radiology, pharmacy, and lab services. We have it all under one roof. I invite you and your entire family to visit us here at Gateway Community Health Center.
In the 1960s, the migrant farm worker movement emerged as workers faced poverty, poor living conditions, and discrimination when seeking fair treatment.
I used to go out in the fields, talk to them, talk to the farm workers that were doing farm work in this particular area. And I realized that a lot of farm workers were having medical problems. I would see them with major cancer, and their arms were distorted, their fingers were distorted. And I would ask them, why weren't they being taken care of?
Led by Cesar Chavez, the movement improved working conditions and inspired the Laredo-Webb County Migrant Health Initiative program. In 1963, the county health department received one of the first federal grants to establish a migrant health initiative program.
The facility was an old TV hospital on Arkansas Street. That's where the health department was at. We had what was called a general medical clinic, and of course, we would see about 40, 50 patients a week. My calling was that I saw these deplorable conditions. I said that there has to be something that we can do.
In 1989, Gateway Community Health Center, Inc. became a 501c3 nonprofit and evolved into a federally qualified health center. Today, Gateway's mission is to provide quality health care for everyone.
When I started in 1994, the clinic was in modular buildings. It was very impressive to see what they had accomplished at that time. So for me, it was believing in the mission of helping people and helping in helping improve, again, their way of life. But the challenges were many.
When I started, I actually came first to Gateway as a dental student on a dental rotation. At that time, we were on Lion Street. It was literally a trailer. It was, and that's where we were in and offered services.
Gateway treats patients regardless of their ability to pay, serving those with insurance, Medicaid, Medicare, and the uninsured.
When I came on with Elmo, the idea was that we wanted to grow even more. We wanted to create access in areas that there was no access. I want our patients to be satisfied with the care we're coming. I want them to come, not because they need to come. I want them to come because they want to come.
Needing that access to care is very important for them. And I think Mr. Lopez and along with the rest of the team realize how important that is for our patients in our community.
It's a primary care physician and the primary care provider. Then the patient needs the dentist. The patient needs an x-ray. The patient needs a pharmacy. Gateway has everything that a patient needs in one place.
Now, as Gateway celebrates 35 years of service, the mission is clear: to provide quality health care for everyone across Webb, Zapata, and Jim Hogg counties.
A lot of the ideas that we get come from the board and also from our team. We have a very experienced team that we've managed over the years to recruit. A lot of our team members, like myself, have a deep hospital management background. Having that recruitment effort of staff and the ongoing training that we give to even our new staff members, that's been the most rewarding, because with good training, we give good service excellence, customer service excellence. I think our patients come back because they're happy with the care that they get, the service that they get. We're doing our job to create access to affordable health care for all here in Laredo and in the surrounding area.
If you want to set up an appointment, make sure you head over to gatewaychc.com or call 956-795-8100 to set up your appointment or become a patient of Gateway Community Health Center. That said, if you want to catch a full rewind of this episode or any of our Gateway Today episodes, make sure you head over to YouTube and search Gateway Community Health Center, and don't forget to smash that subscribe button. As always, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other health care needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100